Hello, Don here. Welcome to Podiatry Practice Mastery. We're helping you get your practice to the $1 million mark and beyond. Today I'm going to go over, this is a recording for a Wednesday, and this is a full day here in my Westboro office. First patient was a 37-year-old gentleman. He's been seen by a couple of other doctors for ingrown toenails, so we did 3 edges of 3 toenails for matrixectomies, and he's going to come back in 3 weeks. Next was a patient number 6 out of 6, shockwave for plantar fasciitis. Now he is not responding great at the 6th session. I'm sending him to PT. Usually by the 5th or 6th session I like to see some improvement. That's the reason I'm sending him to PT. Next patient was a 76-year-old man that's had multiple bouts of gout. He's been on colchicine. I put him on Uloric. I don't usually give that out, but he kind of requested it, so I gave it. I'd love to know if anyone else gives that out a lot, but I did prescribe it for him. Next was a number 3 out of 6 for shockwave. Next patient was a patient that was a 67-year-old man, and he had pain to the bilateral forefoot region, kind of a little bit of like neuropathy, and some forefoot pain on the 5th metatarsal. Really couldn't figure out what it was. He was treated in the past with some gabapentin, but his just foot pain is out of proportion, so I ordered bilateral MRIs on this gentleman to kind of see what was going on in there. Nothing really showed up on x-ray or anything else. Next patient was a 38-year-old man. Came in, I previously treated him on the other side for plantar fasciitis. Now he has some Achilles tendonitis. He's an avid cricket player, young gentleman. Kind of recommended he do icing, anti-inflammatory, foam rolling, things like that. And if it doesn't get better, we'll do shockwave. So this is a gentleman. I use my new treatment sheet for Achilles tendonitis. I'm trying to use these treatment sheets more. I was using my presentations in the past more. Now I'm trying to give people a one-page handout, working a little bit easier. If you want access to those, just shoot me an email. Okay, Don at podiatrypracticemastery.com. Next patient, 56-year-old. She's 3 months out from a bunion. She's had some swelling on the top and reduced joint space, reduced range of motion. And I gave her a cortisone injection on the dorsal aspect. So a little concerning, just the lack of the range of motion in the joint may have just produced a lot of scar tissue up on top. But that was that patient. I'm going to be seeing her back in 3 weeks. Next was a patient that came in for a skin rash on the lateral foot. For him, instead of just starting people on like a ketoconazole or a steroid, I tend to do a 2 millimeter punch biopsy, so I did that on the lateral foot, and I'm going to see him back in a couple weeks and then start him on whatever medication is appropriate. Next patient was a 39-year-old man, 2nd metatarsal head pain. We talked about shockwave in the future. We did x-rays today. He had a little bit of pain, but it's tending to get better, so if it doesn't get better, he'll come back in for that. Next was a bilateral matrixectomy, did for a 19-year-old. Next was a 9-year-old that came in for an orthotic follow-up. Now, he had been in a UCBL type originally for some apophysitis, and he is getting better. This is on the 2nd pair, so they didn't want to go for the 3rd pair. Basically, they're feeling fine, and yes, he has a pronated foot, but if he doesn't have any symptoms, he might not be needing an orthotic for the rest of his life. So I just kind of said that to them, and they're going to come back as needed. And so no additional orthotics were given. Next was a 75-year-old female, follow-up for a fracture, and she had an ulcer on the toes. She's doing better, feeling better, and I'm see her back as needed. There was another young man for a matrixectomy, both edges of both great toenails, and then there was another IND of another ingrown toenail. Next was a 63-year-old. I did an ultrasound, and she's going to be seen back in 6 weeks. Ultrasound for probably her plantar fascia. Next was a shockwave 63-year-old guy, number 3 out of 6 for his plantar fascia pain. He's starting to feel better already. This is that engineer guy that knows all about shockwave because he researched it. And next is a 49-year-old female, had a fractured 3rd met, put her in a cam boot, and I'm sorry, he didn't want the cam boot, and I used the fracture code. So he did not want it I'm not sure why some patients don't want it. I guess he's going on vacation. He wanted to see how that works first after his vacation. Next was shockwave number 8 out of 9. So I usually stop at 6. She needed a few more. She is substantially better, but she had this really bad forefoot pain. After the 6, she was doing much better. She is doing much better than originally, but we did a few more sessions for her. And the funny thing is, she said, I don't like to stop on odd numbers, so I like to do 10. I'm like, we can do 10. You can do as many as you want, but you just have to pay for them. And finally, there was a young girl, a 19-year-old. She caught her toe and dislocated her 5th digit, and so just in the office, I was able to push it over and relocate it. So did like a dislocation code for the 5th toe, but she's much better. So we did x-rays before and then x-rays after to confirm that. So that was the day. We're still struggling a little bit with ModMed. So now we got to figure out the notes. Now we're trying to figure out how to deal with all the documents and everything else. We have our mass PAT, which is like the prescription monitoring. So when we do narcotics, we can check that. So things are going better. They're just like, we don't know where everything is at, and there's not a great who to ask to help us. We just kind of have to figure it out on our own. It's getting better. The notes are getting easier. We haven't quite started to use the protocols yet. We're still figuring out how to do the notes. Once the notes gets better, then we'll turn those into protocols, so make it a little bit easier, I think, in the future, and still learning how to deal with documents. Okay, so until next time, talk to you later.